Okay, guys, it's nighttime and I'm only testing the system. I'm testing my lighting. I don't know what I'm doing, how well the lighting is. So before I start speaking to get to know you, let me check here on Facebook to see what the lighting is like. So give me a second. Let me see. And I'm going to see if anybody's going to sign on. Let's see on Facebook here. All right. Let's see what's going on. Okay. Okay, it's a little dark, but it's okay. Okay, hey guys, I'm gonna see if you're signing on. So it's a new platform I'm on here. So I am testing so that I can be here more frequently just to talk to you. So if you can see me and you see me well, you can put your comments. I'm going to see if the comments are going to come through this platform. It's new. And from here, I can stream to various platforms. So I'm streaming at Cooper Wellness Center, Dr. Cooper, Dr. MD, um, Cooper Internal Medicine, Facebook page. Then I'm going to try to see if I can put together the adding on their Instagram and of course TikTok. So it's only a test. So I don't know if anyone has signed on. I'm going to check here because on this platform, I am not seeing anyone. So let me check here if I see anyone. And it is a test. I think one person is on. Just saw someone. I am not seeing anyone. So let me check here if I see anyone. Okay, so if you're on, just do a shout out and tell me where you're watching from. It is a test, and I intend to start doing some more educational videos and some Facebook lives to so that I we can interact and I can answer questions that you may have. You know that I'm a internal medicine doctor, board certified, and I have been practicing medicine for the last um, 33 years actually. I graduated from medical school in 1991, and at that time, I was pregnant with my daughter. My daughter's now a physician. And today we were speaking. I said, well, you have graduated from medical school twice. That is funny. So I am on the testing, guys. If you have a question, if you'd like me to talk on a particular topic, put it there. I'm testing this platform. So I've been practicing here in the Rio Grande Valley since 1996. I love to educate patients on healthy lifestyle. I will tell you why. You see, I have used healthy lifestyle, plant based nutrition, exercise, stress management to lower my weight and to increase my overall health. And since then, I have been sharing with patients. I have impacted thousands and thousands of patients, whether in the United States or other places, just sharing. My patients right now, I practice conventional medicine with lifestyle medicine emphasis. And many patients, thousands of patients, have gone through the program and have done very well. I'd like to talk about a 25-year-old young man who was brought to my office years ago. Mother, a nurse. He was weighing about 400 pounds. His blood sugar was like 390 the day I saw him. Blood pressure is high, cholesterol is high. He came into the office, sat with his mother. The mother was so disappointed, saying, I am a nurse and my son is severely obese with hypertension and diabetes. We sat down, we came up with a plan of action, changing the way his diet, of course, getting him to start doing some exercise and managing his stress. And believe me, he lost 90 pounds, which impacted his blood pressures, blood sugars, cholesterol. It is amazing to know that you can actually, there are so many chronic diseases that you can actually impact with healthy lifestyles. What are those diseases? You may be told that, hey, you have type 2 diabetes and you're going to need to be on medication for the rest of your life. Now, if a doctor tells you that, this is not necessarily true. So you can actually impact, reverse diabetes type 2. You can improve your blood pressure and lower your medications. You can impact and improve heart disease, um, arthritis. You can impact and improve, of course, obesity. There's so many diseases that can be impacted when you change to a healthier lifestyle. So today I'm just testing this platform, but I want you to look out for me. Tell me what are the topics you'd like to hear. Let me know what problems you're facing. What are your difficulties? How do you like to change? What problems are you having? How can I help you? I have helped thousands of patients here in the United States and all over the world. I love to speak. I have written several books on healthy lifestyle. My beloved book is a cookbook, and I'm not sure if you have the book. Incredibly Delicious Vegan. You can get this book on Amazon. I have 14 Days to Amazing Health. There's so many books. So I do like to teach. And even though I practice medicine, I enjoy seeing my patients come in and say, hey, doc, I have lost 10 pounds, doc. My blood sugar is amazing. I had to decrease my insulin, and we work together to decrease medication. That is called healthcare miracles. There's no need to be on so many medications for so many years. No, you can actually improve just by following a healthier lifestyle. And when we talk about lifestyle, we're talking about habits. Yeah. It's your daily habits that make up your lifestyle. And you can use a healthy life. I don't discuss diet because diet is temporary. If you really want to impact your health for a long time, then you have to change your habit. You have to learn what to eat, when to eat, the quantity to eat. Very important. How to exercise, when to exercise, how to manage your stress, how to relax. All these are part of building or developing a healthy lifestyle. How many hours you sleep? When do you go to bed? When do you wake up? How much water you drink? All that's important. So tonight is only a test, but I'll be back now that I'm understanding how to use the platform. I'll be back to talk a little bit more with you. I'm not even sure if I really understand the platform or not, but I'm going to give you reasons to drink water. You know that water is medicine. You've heard that, but do you really believe it? Somebody asked me recently, is water a nutrient? I said, yes, water is a nutrient. Why? Because water is essential for life. You cannot live without water. So why do you drink water? Do you know that healthcare providers use water as medicine? Mm-hmm. You know, it is not unusual to see an elderly patient who's brought into the emergency room confused, weak, lethargic. We may be thinking, hey, this patient is having a stroke. And after we've done all the workup, we realize the patient is merely dehydrated. And all we need to do is just supplement, put an IV line, start IV fluid, and just give the patients water. That patient's now become alert and ready to go again. Water is good for migraine headaches. Sometimes you may go a whole day with just a small amount of water. You're thinking, did I drink enough water today? When you realize, oh, I didn't drink enough water. The brain is basically 80% water. When you don't drink enough water, those brain cells can shrink. Those brain cells don't function as they should. And this can cause confusion, headache, fatigue. So water is medicine. What about gallstones and kidney stones? We do use water. Patient may come into the office with renal colic, and after sonogram and x-rays or a CT scan at the emergency room, we realize patient has a kidney stone. How do we treat? Of course, we treat the acute pain, but we hydrate. Hydration, hydration. A study was done at Loma Linda University looking at those patients who had 5 or more glasses of water per day and those who had less than 5 glasses of water per day. What do you think happened? The patient who had 5 or more glasses of water per day decreased your risk for venous blood clot by 50%. You see, when you're dehydrated, then the blood becomes more viscous. The cells start becoming more sticky. Stickiness can form clots, and clots can be dangerous. Venous blood clot can move up to the lungs, cut off the, the blood flow and oxygenation, and this can lead to severe problem. So water is good for headache. Water is good to decrease venous blood clot. Water is good for gallstones and kidney stones. What else? Water is good for fatigue. Water is good for constipation. A lot of time patients come in, they're constipated because they're not drinking enough water. You see, after you consume your meals, the meals pass through the mouth, esophagus, stomach, small intestine, large intestine. In the large intestine, water is absorbed from the food material that you have there. And if you don't have enough water, the stool becomes hard. The feces becomes hard. You become constipated. So water is good for constipation. What about weight? Water can also help you to lose weight. Drinking a glass of water half an hour before your meals can partially fill your stomach. So at mealtime, then there's no need to consume so much meal, so much food, and then you can then consume decreased calorie, and that can lead to weight loss. Water is indeed medicine. Water can lower your blood pressure. It is believed, studies have shown that not drinking enough water can put the body in a state of dehydration. The body senses that. Then we have vasoconstriction of the blood vessels that will elevate blood pressure. When you hydrate, then you can lower your blood pressure. Water is indeed medicine. Water is a substance that you can find anywhere. Water is inexpensive. Water does not contain calories. But without water, how long do you think you can live? Water is indeed medicine. So why don't you grab a glass of water? Beautiful glass of water and drink. You know, what I do in the mornings, when I get up, I take 16 ounces of warm water or room temperature water. Why do you think I do warm water? I may add some lemon juice there because the lemon will alkalinize the water. And we know that the body function in a more alkaline state than an acidic state. When you start consuming a lot of plant-based food, these are alkaline food, they're anti-inflammatory. So what I do in the mornings, I get back to that, I take 2 glasses of water, warm water, literally. So it's at the room temperature, but I usually just warm the water up, and that warm water act as a laxative. So if you have trouble going to the restroom, if you're constipated, get 2 glasses of warm water in the morning, and believe me, in an hour or 1.5 hours, you're ready to go to the restroom. Water is medicine. Now, let me see. I still don't understand this platform. Let me see if anyone has a question. Tell me where you're watching from. I'm going to check you out here on my phone. Let's see what I can discover here. Because this platform here is new and I can't see the comments. Okay, guys. All right, so listen, I was only testing the platform. I'm going to see how to sign off. And then, of course, I will come back on with more educational information. So don't forget to follow. I'll see you soon. Bye-bye. Let's see if I can turn this off. Okay, how do I end this? Oh, here. I got it. I see you, Bob.